We are at our second annual Mississippi Medical Cannabis Conference for providers. We have primary care physicians. I talked to a dentist who's here, a lot of nurse practitioners, various different specialties. I've talked to some neurology specialists, endocrinologists. So it's a wide variety of providers that are here. Pharmacists, they're seeing patients that take these medical cannabis products in addition to their regular pharmaceutical products, so prescription drugs. So they need to know how they interact potentially with those products.
I come to learn more about how to help my patients, side effects, the pros and the cons of everything, and to meet people in the industry and to also learn as much as I can about it to try to help my patient. I feel like it's all tools in a toolbox that we can always use if we need to.
Why is it important to get more education about cannabis? Because the landscape is always shifting. And really, all doctors should be basing their recommendations on the best data we have and the most current things we know.
I think the atmosphere here is really encouraging and open. The communication is very open, and I think people are very relaxed and can interrupt a speaker and ask any questions at any time. And they get very valuable information from speakers that are experts in their field.
One of the best things is hearing from the people that are on the front lines of patient care. If we can equip them and educate them, that gives us a lot of satisfaction, and it really helps fulfill our mission to disseminate this information out there.
Medical cannabis in the state of Mississippi is a new frontier, and I think that we have to use the data that we have available, the science that we have available, to do it in a responsible way, keeping into consideration the biological health of the patient, the psychological health of the patient, and the social, spiritual health of the patient.
The conference has been invaluable. Top-notch speakers, just really, really knowledgeable people who are putting a lot of thought and energy into making sure that the information they have is the most up-to-date, but also most accurate, both good and bad. There are people who are very interested in the health and well-being of the patients of Mississippi, as well as probably globally. And people are working and putting in the time and energy to give the best patient outcomes that they possibly can with the best knowledge that we can gain through studies and our intervention in the program itself.